Relevant research topic number 1, DVTs. Well, the whole point of these relevant research topics are to pull together different ideas that have been available in the literature in the last year, the last decade. And one of the areas that's very important is understanding clinical prediction rules. In this area, the research has pulled together tests that are very good at predicting different problems, different diagnoses. For example, DVTs, and that's the topic for this one. Classically, if I say to people, what do you use to test for a DVT? They will say the Hohmann sign. Well, what I want to say is don't use the Hohmanns, all right? An article published in 1998 by Anand and Wells entitled, Does This Patient Have Deep Vein Thrombosis? And it was in JAMA, Journal of the American Medical Association, looked at the problem. 2 million people a year are affected and suffer from DVTs. And these can turn into fatal pulmonary emboli. Even though the medical treatment for it is good, there are side effects if it's not done correctly. Therefore, it's extremely important that we pick up what is truly a DVT. And doing a Hohmann's doesn't necessarily do it. It's a good test that we learned, but in the long run, it's not as good as this prediction rule, the Wells prediction rule. So what is this rule? If you go to that article in 98, or Wells then did a later one in 2006 in JAMA as well, there's several factors, and you get different points for each. Active cancer, immobilization of the lower extremity, recently bedridden, entire leg swelling, pitting edema, and there's various factors such as this that have different variables. You add them up. If the person scores 3 or higher, high probability. If they're older, you can push it up to 4. And that will tell you that that person is at risk for DVT. So here's the research. Use it.